feel a bit overdressed, so let me stand behind the podium. My name is Dr. Ijai. I was part of the second cohort for the African Pharmaceutical Network Regulatory Affairs training. I was asked to share my reflections about the course, and I was just telling some of my table mates that for anyone considering taking the course, it truly is value for money. If for nothing else, do it to boost your confidence. Do it to boost your confidence because when I began it, I remember we went through the room and Dr. David asked what our expectations are or why it is we enrolled for the course. And for very many of us, me included, was that many jobs were passing us by. However, as I've come to the end of the training, it actually occurred to me that we get into spaces of learning and of working and of training so we can be generous to our population. And it's not just it strengthens the person because then you have a capacity to stand in confidence. However, I'd really like for us to think about inverting the pyramid so that we are constantly thinking about how do our skills, how do our experiences, how do our expertise make us more generous to our population. Trainings, learnings, education doesn't make sense if it has no bias towards generosity for the people that we serve. And I think regulatory affairs is as generous as it goes because you're thinking at all levels of the market, of the consumers, of the users of a product. And for me, it dawned on me in the past week that the training was so that I could live generously towards Kenyans. And I want to say that's a hard thing to do when you're a citizen of this country because, yeah, it's a very hard thing to do because that's not appreciated. It's not, I've never seen a job description that says requirements, high generous capacity, you know. Like it's always, you have to be the sharpest tool in the shed. And that's good. It's important that the doctors who handle our things know their stuff. However, I think as you go through this training, if you're thinking about it, and for those of us who've gone through it, it might be important to add generosity to our responsibilities so that at every turn, we are looking at our fellow citizens and at each other with eyes of generosity. And we say, the government is not paying me enough. However, I'm going to be generous towards this patient. I'm tired to my bones. However, this old lady has come and she has questions about this product. And part of my job is to be generous with the skills that I've obtained and with the learnings that I've gotten. So for me, is this a graduation? As we graduate today, I think that's what I'm taking going forward. I would like to thank the faculty for your generosity. When I joined the course by the skin of my teeth. I think we talked to Dr. David, I think a day before the course started, and even then I hadn't decided on whether I was doing it or not. And I didn't have the full fee. I think I just had 1,000 and I paid that and I was like, it's okay, it's a down payment. We can come up with a plan. And you guys, these guys were not on my case about school fees because I ended up settling it quite later in the course. I don't know what's the experience of other people in the room, but I just found our faculty extremely generous with their knowledge, with their time. Thank you for the people you exposed us to. I particularly enjoyed the webinar that we had with Dr. John. I hope that for future gatherings, we would have more of those interspersed with the learnings. It was incredibly invaluable. For the rest of my cohort members, I think we did great. We finished. There's many people who start things and don't finish. So I think if for nothing else, we finished and the world awaits. It's our oyster. So let's go be generous. Yeah.